Okay, those of us who graduated nursing school have been through the most difficult and challenging times of our lives. We spent countless hours in a library studying. We've given up our weekends to try and absorb 25 chapters of information, to sleepless nights wondering if we will make it to the next semester, to working, to going to school, to studying over and over again. But imagine this, spending 4 years of your life pursuing nursing, graduating, and ending up on a unit that makes you unhappy and hate your profession. My name is Wilson, and this by far was my biggest worry when I graduated and came home and hung up my cap and gown. I have put together a video that sheds light on what nursing units have the highest rate of nurse burnout. If you do feel like you are experiencing nurse burnout, I put together some steps that may be of great benefit to you. Nurse burnout is when you chronically feel overworked, unappreciated, and a lack of fulfillment for your job. The biggest problem with nurse burnout is that it affects your mental, emotional, and physical state, and we need a solution fast. Nurses who experience burnout might be very irritable, call out frequently, lack of patience, and overall dissatisfied with their job. They create this toxic environment that damages the integrity of the unit that they're working on. And honestly, they're just fed up. They probably just want to go home, eat a tub of ice cream, and watch some Netflix. That actually sounds pretty good right now. There was an email survey done in February 2017 that went out to more than 600 nurses. As you can see here, being a big part of the pie, 27% voted on feeling overworked. 16% voted that they did not enjoy the job. 15% voted that there is too much paperwork. 12% voted that there is a lack of patient time. Nursing.org highlights nursing units that are high areas of nurse burnout. First being oncology. Oncology nurses form relationships with these cancer patients as participants in the emotional and sometimes lengthy journey of those battling cancer. These nurses may experience acute feelings of loss as they face higher instances of patient death. The second nursing unit that is a high area of nurse burnout is the emergency room. They stay in the emergency department. Cases typically come with a greater sense of urgency than other nursing environments. In addition to facing high pressure situations on a daily basis, emergency nurses handle an exceptionally large amount of patients compared to the typical medical ward in which nurses typically see about 4 patients per shift. Emergency nurses might be responsible for over 50 patients. These conditions often cultivate a burnout-prone environment. I worked in the ED for 4 years. You'd be lucky to even get a lunch. What's a lunch? You think you're getting a lunch? To add my take on this issue, not only are you dealing with a vast amount of patients, some of the people you will be caring for are in very critical conditions. And you might even experience a patient death, which is one of the most heartbreaking things anyone can go through. But let's not forget, your shift isn't over. You have to pick yourself up and somehow still be jubilant. Much respect to my ER, ICU, critical care nurses out there. Love you guys. I sincerely admire the work you guys do. The third one, this is my personal opinion, I think it's the ICU. Here is another unit where death is no stranger, and ultimately bonding with your patient might lead you to become very distressed when they expire. Yes, I said expire. One of the most disgusting terminologies we used in the ED to describe a patient's death. Don't get me started. Being that there is a national shortage of nurses, specialized units are more susceptible to hiring new grads. This information is by no means meant to deviate anyone from being employed by these units. If you are a new grad and have done clinicals and intern on this unit and you do feel like you belong here, then by all means follow your dream. If you are in the middle or undecided, my suggestion would be go to med-surg, build up your nursing foundation, become competent in your skills, and then move to a specialized unit so you can better handle that added stress. Now, battling nursing burnout can be a super tough situation. I'm going to offer some tips so that when we do feel like we are close to experiencing nurse burnout, we have some interventions we can work off of. Number 1, self-care. I cannot stress the importance of me time. Pamper yourself. Go to the spa, get a massage. Nail done, hair done, everything did. 2, Talk to your friends and family. They are very important. We have people in our lives that are meant to support us, to guide us, to help us solve these problems. And if you don't feel comfortable talking to your best friend or family about this situation, you can always seek professional advice from a therapist. Third, exercise. Personal experience, I've found that exercising has helped me manage my stress more effectively. So many different exercises. There's boxing, there's kickboxing, there's yoga, which has like 25 different styles of it. You have strength training, you have CrossFit, you have Zumba classes. So many things you can do. Fourth, you need a hobby. First, you need to find out what you enjoy doing, what you are passionate about. Whether it's makeup and skin products, yes, those 25 items you have in your Amazon account, please purchase at least 9 of them. Splurge on yourself. You deserve it. Or if you are a very adventurous type of person, go Google a trail and enjoy that amazing view from up top and meditate. 5, make sure your body is properly rested. I hope you don't think 5 hours of rest is going to get you through a 12-hour shift. Yes, caffeine might help, but the purpose of this goal is to not rely on a substance all the time. And let me remind you guys, medical errors is the 3rd leading cause of death after heart disease and cancer. We need to be considerate and get an adequate amount of rest. It helps our bodies function. It helps us think better. And trust me, critical thinking is vital in our practice. Number 6, start eating better. Get rid of all that fast food. We all know the benefits of what a healthy diet reaps. And bring a snack or a shake to work. Sometimes us nurses don't even get a lunch break. We need something to refuel ourselves. Number 7, last resort. Now, this is if you stress all other options and you are still dissatisfied. I know this doesn't sound pleasant. You need to move on and you need to try something different. Now, I'm not saying to start a new career. However, there are many different jobs as nurses. Thank God that it is a very versatile field. You can be an infectious disease nurse. You could be a hyperbaric chamber nurse. You can be an operating room nurse. You have so many choices to make. Don't limit yourself and keep trying. We all have experienced someone who is just fed up with their job. But why is this topic such an important issue in nursing? Nurses are dealing with patients' lives. We are there to make the patient more comfortable. We are there to heal them when they are at their most vulnerable state. Patients look up to us and count on us to advocate for them. And ultimately, they count on us to listen to them and connect with them. In BSN programs, yes, they teach us management and leadership, but they also teach us one important thing, that is interpersonal communication. We learn how to actively listen, we learn how to be empathetic, and we learn how to problem solve. It is of paramount importance that we recognize if we ourselves are experiencing nurse burnout or whether one of our colleagues are experiencing nurse burnout. There is a huge complication when someone is experiencing this. They are not easy to talk to, and there is a breakdown in communication. And who does this ultimately affect? It affects our patients. Patient safety is affected, and this is not how us nurses should be going about our career. We ourselves would not like to be on the receiving end of a nurse experiencing burnout, especially if we were in a serious critical condition. If you are watching this, hopefully it did impact you in a positive way. And if you do like this video, like and subscribe, but also leave a comment on what you do to keep your sanity and avoid nursing burnout. Don't be hesitant to send a message if you do need help, and if you do want me to discuss another topic that's important to you, let me know as well. Signing out.